welcome back to my YouTube channel. My name is Yalabu and I go by this name on all my social media platforms. For those that are new here, I'm a Namibian trained nurse currently living and working in Germany as a nurse. Okay, so on this episode, I'll be talking about the Anerkennung process. If I have to translate it in English, it will be recognition process. Okay, so if you attained your qualification in a non-EU country, unfortunately, you have to undergo this process. My process took much longer due to COVID restrictions and lockdowns, but for those that are coming now, I think the process will be about 6 months. So the Anerkennung process entails 5 things. Number one, you'll be working under supervision. Number two, you will have to work in 2 departments, one in internal medicine, one in surgical departments. And then number three, you'll be doing an oral exam. Number four, you'll be doing a practical exam. And number five, you'll be going to classes. You'll be going to classes, beloveds. All right. So when I came to Germany, my first department, so when the hospital came to Namibia to interview us, they asked us, in which department would you want to work and why? And I wanted to work in the dermatological department because I'm interested in this disease, because I remember when I was in Namibia, I had a patient that had worms like in his leg and he has diabetes, and I was like, how come? I wanted to know more about this, and I told my bosses that I want to work in the dermatological ward. I want to know more about this disease and its treatment and how people end up with wounds that are not healing and all that. And I thank God I ended up in the department where I wanted to end up. So I was working for the first 6 months in this dermatological ward, and then after 6 months I went to a surgical ward, and that surgical ward has to do as well with PFOCA, like it has to do with blocked veins, and also due to diabetes, due to high cholesterol, and due to obesity, and due to prolonged smoking and all those things. So it kind of go in the same line with diabetes. So I worked in a surgical ward, I worked in internal medicine, so that prepared me for my exam, so to say. Yes, beloveds. And while I was working in the hospital, like 5 weeks I was in the ward, and 5 weeks I was at school. And at school, we came 15 of us from Namibia to Germany, and we were the first group that Talent Orange recruited from Namibia. So me and my colleagues, we used to go to this class, only us Namibians, no other people. And we used to get lecturers from the hospital nursing training center. So then they'll be teaching us about the diseases that are more common in Germany. They'll be teaching us about rules and regulations. They'll be teaching us about rights, and they'll be teaching us about different insurances and all those things, and our responsibilities and how we can involve other members from the health sector, like physiotherapists, social workers, psychologists, how we can involve them to make sure that our patients are well taken care of. Yeah, genau. Yes, beloved. So, and then, the period went on like that, and then late, and also during this classes time, we had like probe exams where two teachers from the training center and our boss used to come and then see our progress. How is our German getting on? How are we understanding the content? And just to prepare us for the big exams, because the big exams, somebody from the health ministry will come, because they are the ones granting us the licenses. Okay, yeah. So during the classes, we literally used to learn more about the diseases that are more common in Germany. Although we studied in Namibia, but we had to learn it again in German, because words are different. Um, Not words, let me, how should I say it? Concepts and medications are different. They are known differently and not really known differently, but they have perhaps other names. And because there is in every medication there is a domain name, I believe, from which chemical that comes from. But other firms may um, call it. How can I make an example? Mm, how can I make an example? How can I make an example? Yeah, yeah. I cannot really find an example now, but like when I came to Germany, I used to pronounce medications in English. Like I would say, I want amoxil, and the nurse will not understand me because, for example, in German they said amoxicillin. So we had to learn these things, if you get what I mean. And then after our process, then we got appointments that, Miss Yalo, you'll be having your oral exam when. And yeah, so I think I had like 2 weeks to prepare for my exams, and then I have to learn everything. Just to clear up, we studied many diseases in Namibia, but they are not so endemic to us. Okay, we are dealing with our in Namibia. We are dealing with our TB. We are dealing with our malaria. We are dealing with our diarrheal diseases. We are dealing with our hepatitis and all those things. Those are the diseases that we are dealing with on a daily basis. Yeah, and Germans, or they are dealing with their pneumonia. They are dealing with their um, chronic obstructive pulmonary diseases. They are dealing with their dementia. They are dealing with diabetes. We also have diabetes in Namibia, but here there's a lot of diabetic patients. They are dealing with heart failure patients, a lot of cardiovascular diseases here, and they are dealing with a lot of cancer. We also have cancer in Namibia, but here, beloveds, I have met a lot of patients that are dealing with cancer. So we just had to learn more of these diseases and yeah, how we can deal with them and all those things. Okay, yeah, beloveds. And then I had my oral exam. In oral exam, I went on that day. I went, and then the secretary, there was a bowl with different cases, not with the name of the disease, but maybe case A, case B, case C. So you you take one from the bowl. It's folded. You take one, and then you show it to the secretary, and then the secretary will take the paper with that scenario and give it to you. And then I think you get 45 minutes to prepare yourself. You can also get a pen and paper. You can write down your thoughts and all those things, arrange your thoughts, and then you enter the room. Then there were three people, um nurses, not nurses, lecturers from the nursing training center. And yeah, I think there were only two. This time around we didn't have anybody from the Ministry of Health, but they were noting down everything. Whatever you say, they note it down because we are not doing a written exam, however, an oral exam. So, and then I got my case. It's usually the age, the symptoms that a patient is having, the medications that they are taking, and all that. It's like literally a whole health history of the patient. And then I had to diagnose my patient. Looking at the symptoms, I have then to diagnose my patient. And then there are questions: what are the treatment options? What are your nursing interventions? And what insurances does this patient qualifies for? How can you involve other members from the health sector? And And then I believe my patient had COPD, which is chronic chronic obstructive pulmonary disease, and he also had pneumonia, or he developed pneumonia. Yeah, we have two pneumonias, one that is acquired in the community and one that is acquired in the hospital. Okay, nosocomial pneumonia and I think community pneumonia, if I'm not sure. Yeah, so my patient had already, this COPD, and then he developed again pneumonia, which is not so good. They say pneumonia is old man's friend, because many people, older people really die from pneumonia. Okay, so my case was a little bit complicated, so to say, because my patient already has a condition that affects his breathing, and then he developed pneumonia. Pneumonia is actually infection of the lungs, not like TB, but it's like, yeah, it's that. So yeah, then I had to talk about how will I treat my patient, and because with a COPD, you can only give the patient oxygen until 4 liters. After that, nothing will really help. So now my patient has pneumonia, and usually people with pneumonia, you have to give them oxygen. So it's all these contradictions. So they gave you conditions that are maybe interlinked with the others, so that you know how to treat, because it might be how should I put it, contradicting each other, these two diseases. So you have to know, you have to study, you have to know really, because they'll ask you questions as well. Yeah, but thank God it went well. I passed. I didn't have to repeat my exams. So, and then after I think a month, I got an appointment for my practical exam. So in the practical exam, it's actually a clinical instructor and then a nurse from this nursing training center. I'll just check if my mic is still on. Still on. So, and then the nurse from the training center, they will come and then they will talk to the nurses in that ward. I had my exam in the surgical ward. They'll come and talk to nurses in that ward and say, okay, Miss Yalo is having her exam tomorrow. Which patients can you recommend for her? And then the nurse will be like, I think that patient is a good candidate and all that. And then the clinical instructor, sorry, and then the teacher will go to the patient and they'll be like, we have a nurse here, she's having her exams tomorrow, are you willing for her to do her exams on you? And then the patient has to sign, and then yeah, but I will not know which patients I'm going to be doing my exams on. Nobody will tell me. So, and then the next morning then I get a paper, right? And then that paper will tell me is patient who and what we want you to do. I remember in my case I had to do cephalocaffer band. Cephalocaffer is a central venous catheter, no? Goes here or sometimes in the inguinal areas and whatnot. So I had to do the fluster. I have to change the fluster and measure vital signs, interpret it, and also tell the patients about it and tell her about the normal ranges. And then my second patient had diabetes, and he also had this diabetic fit. Diabetic fit is actually, some patients with diabetes, they kind of lose their nerves sensibility. So like maybe a person with diabetes is walking barefoot and like a thorn, kind of, or let me say they step on a thorn. For you, that is, you still have your senses, you or motoric senses. You feel, oh, what did I do? I stepped on a stone and whatnot, and you react. But a person with developed diabetes will not feel that, and sometimes patients they don't feel that, and then a wound develops, and it's very difficult to heal this wound. So then later they'll have this diabetic feet, or sometimes when they are not really well, or they are not taking their medication seriously, like to say or they're not taking their medication seriously, or they're not injecting them the insulin properly, or they are not changing their eating habits, and the blood sugar is always high. That can also damage the nerves, not the nerves, but the veins and arteries. And then later, oxygen flow and blood flow will be reduced to the extremities, and then they start drying up, and then it's what we call gangrene. It really turns black. So, but my patient didn't have a gangrene. He had like just a diabetic feet, like soles that were not healing. So then I had to tell him about the diabetic feet, how he can take care of himself, that the other feet also doesn't turn to a diabetic feet, how he must, when he wants to cut his toenails, he must go to a specialist for that. In Germany, we have people that study just to handle foot care, or how he can inspect his feet by putting a mirror on the floor, and then he can inspect it. If some people are, sorry, are so thick they cannot really pull up their leg like this to look at their feet, so they can use the mirror. Or you also, you can also use the mirror just to inspect your feet if you have diabetes and not really obese. It's not really just for obese, but that's another technique as well. And how you can wear comfortable shoes. We have diabetic shoes, which are formed very well, so that because some shoes, if they are maybe not well fitted, it's a problem again. So this diabetic feet, you go to a specialist again, and then they'll measure your feet and give you a good shoe. It's not really pretty, the shoe, when you look at it, but it's for the benefit. So I had to talk to my patients about this, and he was telling me, sister, I like swimming so much. I like riding my bicycle, and I don't like these shoes. And then I was just telling him the benefits of the shoes, that yes, he can swim, but he just have to make sure that once he come out of that water, he must dry his feet so well, because when it's moist, bacteria come, fungus, and all those things. Let me just drink. So yeah. Mm. So I just had to talk to my patients and tell him about his diet, his insulins, and all that. Yeah, and that was like also part of my exam, to like leading a conversation with the patient, like giving health education. So I was also allocated marks for that. And then the other thing, I had to measure blood sugar, interpret the results, and then inject insulin. So they check, are you injecting correctly? Are you using the right needles? Are you disinfecting? And all those things. And then for my other patient, I had to do like a cervical cluster, like I mentioned. And they are checking, am I changing my gloves? Am I disinfecting well? Am I wearing a mask and all that? Did I inform my patient to turn? Because, this is very sensitive. And if the patient is maybe talking and the saliva is entering here, it can really lead to sepsis and a very bad infection. So all those things, they took all that in consideration. And yeah, and that was all. But I did not like, after my practical exam and oral exams, I will not tell you that, Marcialo, you have passed. They will not tell you that you have passed your exams. Yeah, it will be, I think it's too dark. Let me just see if I can increase the lighting a little bit. They will not tell you that you have passed, but after 4 weeks or so, then you will get a letter that you have passed your exams. Now you need to prepare your documents, especially your B2 level, the German certificate that you got, your original degree, your passport, and I don't remember much. And other documents, so much bureaucracy, so much things that you have to do. So you take those documents, you go to the Minister of Health. I'm so sorry, I'm sitting outside and there's a lot of helicopters and aeroplanes. There's an airport nearby. That's why it's so loud. That's why I try to use my mic. So sorry, beloveds, for the noise. And inside is too dark because the sun is not shining today. Yeah, that's why. So, but let me not make my problems your problems. I'm here to talk about the Anerkennung process. So we continue. Yeah, so you take these documents, you get an appointment from the ministry, you take this document, but before that you go to the police, I believe, and then they take your fingerprints to see if you don't have any criminal record. So you take your fingerprints, and for that I think you also pay 13 euros, I'm not sure. So once the Ministry of Health and Social Services have your fingerprints, then they will call you, then you get an appointment, then you take your original documents, and then you get your license. And after you get this license, you can work wherever in the world. Also, from Namibia, you can also work wherever in the world. Nursing is international. Diseases are all over the world. Treatment is the same, under World Health Organization requirements. Yeah. So if you are a nurse, you can work wherever in the world. Okay, now, so you get your license, and I think you have to pay a fee. I'm not sure if it was 130 euros. I'm not sure, but it's a once-off payment. But back home in Namibia, you pay every year. You pay, I think, 385 Namibian dollars. I'm not sure, but you pay it every year to the nursing council. But in Germany, we don't have a nursing council, but we however have to pay this fee to the Ministry of Health and Social Services. All right, beloveds, I think I have covered almost everything that entails Anerkennung process. So now you know what you'll be undergoing. And after I got my license, I started working independently, and I was working more on night duty, weekends, public holidays, and all that. And my gross, there's net and gross, and I think my gross salary increased with 500 euros after I got my license. So there's a huge difference, when you get your license, the gross salary index increases, but like my salary in nursing in Germany is not stable, because maybe sometimes I work more night duty, or 1 month, like let me say April. April has so many public holidays, if Christian holidays, is Easter and all that. So if you're probably working in April with so many public holidays, and you'll get paid more, or December, whatever months with a lot of public holidays, you'll get more money. Or if maybe you're working on a lot of night duties, or maybe you're working a lot of overtime. Yeah, so in overtime is usually when maybe one nurse is sick, then the boss will call you, "Do you want to come work for 175%?" And then if you're free, you can say yes. And then you also get more money. So that's why my salary is not stable. It changes depending on public holidays, or my night duty, or my schedules, and all that. Yeah, that's why my salary is not stable. But I will not really say much how much was the salary in Anerkennung, but it was enough, way better than in Namibia. It was enough for me to live comfortably, pay my rent, help my family, travel, and buy things that I need. I specify need, because wants are different, but things that I need. Yeah, the salary was enough, and it's still enough. Okay, beloveds. Yeah, I think that's all. I thank you so much for stopping by, and please consider subscribing, and consider sharing the content if you have people that wants to come work as nurses. And yeah, do remember to subscribe, beloveds. I need subscribers. And yeah, thank you so much for stopping by, and until next time, goodbye. And if you have any other questions, please leave a comment below, and I'll do a video. This video, I'm doing it, I don't remember her name, but she asked me to do this video. So dear subscriber, this video is for you. Thank you so much, and goodbye. Much love.